Everyone, Dr. Luke Peterson here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about dental procedures and antibiotics after knee replacement surgery. Hey everyone, so this is a common concern, a common question I get. After knee replacement surgery, having a dental procedure and the management of having antibiotics, do I take antibiotics before the surgery or before the procedure? Do I not take antibiotics before the procedure? Why do I have to take antibiotics? So on and so forth. So with dental procedures, what happens is there is the risk of bacteria getting from your mouth into your bloodstream. And this is called bacteremia. And what can happen potentially is the bacteria that enters your bloodstream can travel to your knee joint, and this can then lead to an infection in your new prosthetic, in your new replaced knee. And of course, this can lead to all sorts of problems, most notably, of course, the failure of the knee prosthetic and the need for a revision surgery. So obviously, that's something we want to avoid. So what are the recommendations? Well, first off, the common recommendation is to avoid any type of dental procedure for 8 to 12 weeks after your surgery. So first 8 to 12 weeks after surgery, just avoid any type of dental procedure. I mean, unless it's a, emergency procedure and it needs to be done, that's a little bit different, but any kind of elective dental procedures, anything like that you can put off and wait till that 12 weeks after surgery. Then also, what is recommended is to take antibiotics. So you want to take them before the surgery prophylactically. And what this does, of course, is the antibiotics are able to get rid of the bacteria in your system, in your body, which means that then the bacteria cannot travel through your bloodstream to your knee and cause an infection, or at least it reduces that risk. And so the common recommendation is that you should take antibiotics prophylactically before any dental procedures for at least 1 to 2 years after knee replacement surgery. And then some surgeons and some dentists will recommend that for just the rest of your life. The rest of your life after having knee replacement surgery, take an antibiotic, help reduce the risk of that bacteria getting into your bloodstream, getting to your knee, and causing an infection. Now, bacteremia, bacteria in the bloodstream, what they have seen is there's a lack of high quality evidence that if the bacteria gets into your bloodstream, that the risk of the bacteria then getting into your knee and causing infection is actually lower than they initially might have thought, or at least there's not much evidence to support this high risk. And so a lot of things discuss how in your normal daily activities, such as brushing your teeth, such as eating food, chewing gum, whatever it may be, there's potentially a higher risk of bacteria getting into your mouth, getting into your bloodstream with those activities than with a dental procedure. One of the reasons that being, of course, is with a dental procedure, the dentist is practicing very sterile techniques, using sterile equipment, all sorts of best practices, so that the risk is actually relatively low. And what they've also seen is there's not really a great correlation between bacteremia, so bacteria getting into your bloodstream, and the risk of joint infection. So the bacteria, certain levels of bacteria may get into your bloodstream, but they haven't shown that this leads to an increased risk that then you're going to get a subsequent infection of your knee replacement and of your joint. So the guidelines have really changed over time. If you look at a lot of associations, a lot of orthopedic societies, dental societies. The recommendations have really changed, and what they've written and what they're saying now is prophylactic antibiotics, so taking antibiotics before a dental procedure, may not, and they think really isn't necessary. As long as you're practicing good oral health, as long as the dentist is practicing sterile techniques, all best practices, there isn't really a greater risk of getting an infection with a dental procedure. Now, if you're someone who is at greater risk for infection in general, maybe if you it's very early since your knee replacement surgery, so you're having it within that dental procedure within the 12 weeks post-op. If you're someone who is getting a very significant procedure where there's going to be a lot, it's very invasive and there's going to be a lot going on, or if you're someone who just has a history of getting infections or you have a compromised immune system, then of course, then it might be very beneficial and very prudent to take antibiotics in that prophylactic manner. But if you don't have any of these risks, then it's not necessarily any benefit to take antibiotics prophylactically. Now, a lot of doctors and a lot of dentists will say, well, what's the downside of taking an antibiotic? And let's just continue to take the antibiotic prophylactically. It may give a benefit, it may not give a significant benefit, but there's not really that any risk. And that's kind of not totally true, at least in my opinion, and from some things I've read. And with antibiotics, if you continue to take antibiotics and a lot of heavy antibiotic intake, this can lead to antibiotic resistance. So then bacteria that was potentially killed and destroyed with the antibiotics, now there's this development of this bacteria that is resistant and won't be killed and won't be destroyed by the antibiotics, and in effect making the antibiotics ineffective. There's also the risk of, your body you have your gut biome and you have the bacteria that are healthy bacteria throughout your body. And most antibiotics aren't very specific. They won't target just the bad bacteria. They're going to kill and destroy all sorts of bacteria, the good bacteria and the bad bacteria. So when you take antibiotics consistently and all the time, you're starting to break down that gut biome, and something that is very important, and there's more and more research coming out that's beneficial and important for the health of your digestive system, but also the health of your body in general. So those are some of the risks to keep in mind. So at the end of the day, I'm not a doctor, I'm not a dentist, or I'm not a medical doctor, I'm a physical therapist, I'm not a dentist, and you should listen to the recommendations that your doctor and your surgeon provide you. But just wanted to share with you kind of what is out there in the literature and what the guidelines are from these different organizations, orthopedic organizations, dentists, and let you make an informed decision and have that discussion with your providers as well. All right, so this has been the Need to Know Show. We were talking about dental procedures and antibiotics and what's the information and research out there. And thank you very much for watching, everyone. As always, please subscribe. If you aren't already, I post videos daily. Leave a like, leave a comment or a message or question, and I'll get back to you in a timely manner. Have a great rest of your day, everyone.